Everyone, let's talk about some of the prometric exam questions. A mother who is planned for labor induction is started on intravenous medication. She is in the first stage of labor and is having regular and increasingly stronger uterine contraction. Cervix is 1 cm dilated for the past few hours. Both the mother and the baby are being monitored. Which of the following signs should alert the midwife? Baby's head not engaged, decreasing the heart rate of the baby, mother's blood pressure of 110/60, and mother's perspiration and increased thirst. So blood pressure of mother is normal, but decreasing the heart rate of the baby is a warning sign. So that is the one to alert the midwife. A woman was discharged from gynecological ward after gestational trophoblastic disease, that is molar pregnancy. Which of the following is the best advice to give her? Never be pregnant again. Request the doctor for sterilization. Consider hysterectomy. Avoid getting pregnant for at least a year. So this is the correct answer. Postpartum mother is to be discharged on the second day of her forceps delivery. She had episiotomy sutures and perineal tear repair. She is breastfeeding her baby and eating the special food provided by her family. What discharge teaching needs more emphasis? So here she is eating food, but she has some episiotomy sutures and perineal tear repair. So the diet is not a problem. Newborn care and vaccination is not an issue as there. Hygiene practice and alert signs to report, family planning and child growth monitoring. So the correct answer is hygiene practices and alert signs to report. When performing postpartum assessment on a woman, there is presence of clots in the lochia. The nurse examined that these are larger than 1 cm. Which of the following nursing action is most appropriate? Document the findings, notify the physician, reassess the client in 2 hours, and encourage increased intake of fluids. So the correct answer is notify the physician because it is more than 1 cm. It is bigger clot. Maybe it's a sign of bleeding. A newborn is delivered by a midwife. The umbilical cord has cut safely by the following necessary aseptic techniques. Which of the following intervention is the most desired? Assess sucking response, increase mother-child bonding, assess the record and Apgar score, keep dry and maintain thermoregulation. So the correct answer is keep dry and maintain thermoregulation. After cutting the cobia, the nurse was educating postpartum woman during discharge about importance of breastfeeding. Which of the following, if said by woman, indicates that there is need for further education? Breast milk is nutritionally balanced. Breast milk reduces the risk of infection. Breastfeeding promotes mother-child bonding. Breastfeeding prevents pregnancy. So the correct answer is breastfeeding prevents pregnancy. If she says so, she needs further education. 34 weeks of gestation unit is admitted to the neonatal intensive care unit immediately after delivery with respiratory distress syndrome. Heart rate of 140, respiratory rate of 77, and temperature of 36.5. Which of the following method of feeding is recommended to promote with this premature? Enteral feeding of breast milk, enteral feeding of premature formula, oral breastfeeding, and oral premature formula. So the correct answer is enteral feeding of breast milk, tube feeding, because the baby cannot suck. Sucking increases the respiratory rate over and over again. A newborn with hyperbilirubinemia was started on phototherapy. What will be the nurse's instruction regarding feeding? Feed glucose drinks, breastfeed 2 hourly, bottle feed till the bilirubin level reduce, breastfeed alternatively with bottle feed. So the correct answer is breastfeed every 2 hours. Thank you and see you in the next class. Subscribe, and if you have any comments, please put it in the comments.